it was difficult to see what they were going through at the time and how kind of abandoned they'd been. We turned up on that first day and were spoken to by the manager, and she was like on the verge of tears telling us the situation they were in, and we were all sat there and just kind of waited for a minute, and then we're like, right, well, let's get to work. What do you need us to do? And we started off by just deep cleaning everywhere as much as we could to make sure that the infection was gone. Cleaned rooms of people who had sadly passed away and who had had COVID but were at hospital or various things. So just by giving them that release and give them that time, it then allowed them to process what they'd been through. So it wasn't until we'd been in the home for about a couple of weeks when you'd have staff come over to you and just break down in tears because they were suddenly processing that they'd lost friends and they'd lost people that they cared about, and that was quite difficult to see. And then the residents themselves were just so isolated because they were in their rooms 24/7 and they couldn't see family, they couldn't see friends. So we tried to set up iPads so that they could have communication with family, and we arranged for some people within React to video call them as almost like virtual friends, and seeing the difference that made to some of the residents. Like we had a man who was, you'd go into his room and he would be threatening suicide and just burst into tears, and it was really hard to see. We set him up with a video call and he'd be on the phone for like a couple of hours to this person chatting away, and the difference that it made to him just having someone to speak to that he could see, that wasn't in a rush, wasn't just trying to get care done which they needed, but could spend that time with them. It made a massive difference. Although kind of for us, when we think about it, we're like, well, we were just doing a job. From discussions I had with staff at the time, they're like, it was literally a lifeline because we didn't think that we could cope if you hadn't come in when you did, which is always kind of lovely to hear, but also you're like, well, I was just doing my job. So to know that it had that much of an impact on them, and I think it made them feel like they weren't drowning anymore.